Hello, everybody. My name is Fred Brown. Karen Ferris and I are very proud to be the co-chairs of the board for the Agape Clinic for the years 2020 and 2021. We're here tonight to welcome you to our 2020 Agape MASH Gala, which is a virtual gala for the first year and hopefully for the last year. We're here to celebrate the accomplishments and the works that we've done this year and to thank our partners. Many individuals and organizations have strongly supported this gala event this evening. But we would like to thank our major sponsors, Roach, Howard, Smith and Barton, AIDS Healthcare Foundation, and the East Dallas Christian Church. Thank you very much for your support. 2020 has been a challenging year because of the COVID pandemic. We've had loss of jobs, people have had to be shut into their homes, and many have been affected with health issues. Many individuals and organizations have also been affected in not only our city, but in our state and our nation. We want to especially thank our dedicated staff and volunteers. Through their support, our community has mobilized our resources and served a record number of patients. Special recognition tonight goes to our medical team at Agape, headed by Dr. Bobby Baxter and Gary Foster. Those individuals that have supported them and our goals for the year have included Eduardo Alvarez, Lupe Delgadillo, Dora Gonzalez, Felicia Rodriguez, Jessica Cardenas, and Mahim Velasquez. This group has worked tirelessly to provide excellent health care to thousands of uninsured patients in the East Dallas and North Texas area. We also want to thank Paul Hoffman, who has stepped in as our interim director for the last 5 months of 2020. His leadership and calming effect during this pandemic have been unsurpassed, and we thank him for that very much so. Special thanks also goes to Dr. Ellen Kitchell, who is an infectious disease doctor here in the Dallas area. She has helped us in setting up safety protocols and setting policies and procedures so that we can get back in business after a shutdown earlier in the year. And now I'd like to introduce Karen Ferris, the other co-chair of the Agape board, who will add her comments to the gala tonight. Karen?
Thank you, Fred, and hello, everybody. You know, Agape has been serving North Texas for over 37 years, and there's so many people to thank for making this possible. You know, each year our work is facilitated by a network of partnerships which have proven especially critical to us this year. First of all, I want to thank the individuals, the United Way of Metropolitan Dallas, and the SMU Innovative Lab for providing donations of personal protective equipment, which help to ensure the safety of our patients and our staff, and without which we could not have continued to see patients. Thank you to our longtime partner, LabCorp, for providing our patients with lab testing they needed to diagnose and to manage their conditions, and to Relief for Americas for giving us medication that we can provide to our patients for free. A special thank you to our educational partners. First of all, Texas A&M School of College of Dentistry, to Baylor University Harrington School of Nursing, and to the University of Texas Southwestern Medical School, who provide thousands of specialty visits, giving our patients special access to their expertise. Last but not least, we want to express our gratitude to the many generous donors whose financial support make our work possible. You've been a blessing to us, and we really don't know what we would do without you this past year. Thank you to the David M. Crowley Foundation, to Highland Park United Methodist Church, to the AIDS Healthcare Foundation, the Lord Sees Foundation, Southern Methodist University, the Corrigan Goddard Foundation, the W.P. and Beulah Luce Foundation, the Samuel Roberts Noble Foundation, the Make It Count Foundation, and the North Texas Cares Funders, the Dallas Foundation, United Way of Metropolitan Dallas, and the Communities Foundation of Texas, and the Rotary Club of Park Cities. Thank you, thank you, thank you. So now I would like to turn the program over to Dr. Baxter, our founder and medical director. You know, Dr. Baxter has been an active volunteer since the clinic opened in 1983, but this year in particular, with all of the challenges that we faced with COVID, we don't know what we would have done without her leadership. So Dr. Baxter?
Hi, I'm Dr. Barbara Baxter, the founder and medical director of Agape Clinic. On March 12th, we had a patient come to our clinic who had a fever, and a sore throat, and an upper respiratory infection, and we thought we might have a COVID case. This brought into question how we do everything at the clinic. And after taking care of the patient to the best of our ability at that time, we actually shut down the clinic for about a week and re-engineered all of the procedures that we do here. We initially went to almost entirely telemedicine visits, which means mostly telephone calls. And because we don't have a very advanced telephone system, we were mostly using our own cell phones to make these calls. We didn't know what would happen to our productivity, but actually it turns out that when you reach people at home, you have a much higher showing up rate than you have when you have people come to the clinic. So our no-show rate went way down, and we actually improved our productivity by 34%, which is amazing. So we have done we've done more medical visits this year than we did last year. We did lose a lot of dental productivity though, because of the aerosolization of secretions when a dentist is working in a person's mouth. The precautions and the re-engineering for them turned out to be much more extensive, and they were actually shut down for quite a while during the year. So we have made a lot of engineering changes to our functions, and that was spearheaded mostly by Gary Foster, our head of operations, and with assistance from Ellen Kitchell, who is a University of Texas Southwestern Medical School professor in infectious diseases, who happens to be a member of Grace Methodist Church and a steadfast and very loyal volunteer physician at our clinic. So we're very grateful to have had those two people to help us come about in a totally new way with just a week of downtime. Many other clinics in the area were completely closed the first couple of months of the pandemic for various reasons, but not the least of which is some of them had staff that became infected very early on. So we have much to be grateful for this season, and we're very grateful for you as well.
Hello, my name is Gary Foster. I'm the clinical director. Been here for about 5 years, more than 5 years, I guess. And what I'd like to talk about is the impact that COVID has had on our patient population, and to some degree, our staff as well as our clinic. COVID has hit the community really hard. The majority of our patients are the working poor. As you hear on TV, the essential workers. Unfortunately, that also means that they get a higher instance of being exposed because they're required to be out there. Those are the patients that we treat. Most of them don't have insurance. Well, all of them don't have insurance. And if they do happen to have insurance, they can't afford it. They can't afford the deductible or whatnot. The patients that we have are not your typical homeless patient. They take a great deal of pride in what they do and how they do it and taking care of their family. And we help bridge that gap to provide medical care that they otherwise wouldn't be able to afford. Because they can't afford medical care like, perhaps you or me or our neighbor, their medical conditions get really, really out of control. By the time we see them for the first time, a lot of them, their diabetes is terribly out of control. We might have to send them to Parkland for a diabetic wound. They may even be in renal failure from diabetes. But the good thing is we're able, with the resources that our donors provide us, we're able to take care of them, get them stabilized, and keep them out of the hospitals, and allow them to continue to work supporting their family. The problem with COVID is it completely disrupted all that. A lot of them that weren't absolutely essential got laid off, or got fired, or there's just no work, period. And so they sit at home, they're under quarantine, they can't go out and make any money. If they're not making money, they can't pay their rent, they can't pay for food. And as I'm sure you've seen on the news, you know, the demand for the local food banks is just astronomical. We had one lady sit 8 hours at the fairgrounds trying to get food for her family. And by the time she got up to the top of the line, they'd run out. So she came by here asking if we had anything. And that was when we decided we would put together a little makeshift food pantry until North Texas Food Bank and some of the other food banks could kind of rally together and help. It's not one of our missions, but it's something we needed to do because if the patients can't eat, they certainly aren't going to worry about taking their medication. You know, as a result of not being able to pay for food, not having a job, the few medicines that they do take, most of them can't afford it. So if we don't have the medication here that has been donated through either AmeriCares or Direct Relief or private donation, then if we don't have the funds available to pay for the medication at Sam's, they go without the medicine. Now, we're lucky in the fact that we have an agreement with Sam's on Northwest Highway that all of our patients can utilize their pharmacy under our membership, but only the pharmacy. And the idea is it allows us to access a 400 medication formulary at the $5 and $10, $4 and $10 list that they offer. The problem is that if they can't afford even a $4 med, then we have to try to purchase order that, and that comes out of a budget. And of course, you know, our budgets are tight too. So we provide what we can when we can, but it is so helpful to have the grants and the donations that help offset that. These people want to contribute to society. They want to have a job. They want to be able to pay for their stuff. But this pandemic and the COVID and the circumstances that we all find ourselves in has made it extremely difficult. And depression is a huge one right now. Lack of self-esteem. It's all things that work together. And luckily, the donations that are provided by our donors help us, help them. And I think our society is better for it. I think it shows humanity on our part. And I'm proud to be part of it. And I wouldn't want to work anywhere else.
Hello, my name is Luz. I'm here to talk about the Agape Clinic. First of all, I want to say that I know about this clinic for my sister-in-law. She told me about this clinic because at that moment I was having really bad health problems. I have heart disease, diabetes, high blood pressure, cholesterol. I am a patient with lymphoma non-Hodgkin remission, so I've been taking care of that as well. I have hair disease, like I said. I have so many problems, and the reason that I choose this clinic instead of another clinic or hospital is because I wasn't working, so I was not able to have an insurance because my status didn't get it, didn't get me one, and it was really expensive. Another clinic, and like when my sister-in-law told me about this clinic, I felt like there was someone there to help me to take care of my health. And I want to say that doctors here are amazing. You can tell that the doctors care about you in the way that they treat you, they respect you, they make you feel that your health is important, that there's somebody there for you. And I wanna thank my doctors. I wanna thank the person in front. I wanna thank God because there's a place like this for people who can't have an expensive treatment somewhere there in the hospital or in another clinic. So yeah, this is a very, very important place for us, especially for me because I've been taking care. Now my health is in a better control now, especially for all because all the things that I've been going through, and knowing that I have a doctor who takes care, a nurse, a practitioner, a person that they know me by name. When I cross the door, they were, "Hey, Luz, how are you?" I mean, you can have that in a big hospital or in a big clinic because this is a different treatment. So yeah, I want to thank everybody who's involved in this. I want to thank to everybody who put everybody who puts just something to make this happen. Thank you.
Buenos días, mi nombre es Irma de Lira. Yo me informé por la clínica Agape por una amiga que ella también estaba en recursos económicos bajos y ella me comentó de esa clínica y yo en ese momento pues teníamos un salario bajo por mi familia, que éramos 5 de familia más los 2 éramos 7. Entonces yo fui a la Agape y vine aquí donde estaba todavía la iglesia, ahí me atendieron y yo tenía diabetes, tenía alta presión, tenía colesterol y tenía tiroides. Y vine y me atendieron bien, el copo del pago yo di $20 de primero y me gustó cómo me atendieron y también ellos me daban el medicamento que ellos tenían aquí y el que no me lo daban y me lo mandaban a la Walmart. Y pues la verdad sí me gustó cómo atendían aquí y entonces yo estuve aquí viniendo, ya tengo 9 años viniendo a esta clínica y por la verdad sí me gusta. Y en cuanto a lo económico, pues la verdad yo sí tenía los $20 como donación para darlo de todo corazón. No se me hacía dolor dar esos $20, porque con esos $20 me daban medicina y yo la que compraba eran $5 a $10 más, entonces no se me hacía caro. Sí tenía las posibilidades de dar los $30 por mes o por cada 3 meses. Y en cuanto a... ¿qué llama?
Porque es importante.
Me gustaría que quedara la clínica Agape, porque yo sé que somos muchas familias hispanas que están necesitadas de verdad, que no tienen dinero, no tienen con qué comprar sus medicamentos. Pero yo quisiera que en este dado caso que el que esté leyendo esto o que interprete esto, sí me gustaría que se quedara la Agape, porque ustedes no saben cuánta necesidad hay en personas que yo he visto que no tienen ni para comer. Sí me gustaría que la tuvieran abierta.
My name is Jessica. I'm a medical assistant here at the Agape. I started volunteering. I couldn't find a job. I was heavily pregnant, but I wanted to stay in the medical field. So I found the Agape, and they're like, you know what, we need somebody to help out with GYN. Why don't you come on over this Friday? So I came in and I got started. And so I was about 37 weeks pregnant, and they called me in and they offered me a position to work here. And I told them, you know, I'm pregnant. Like, I'm gonna have a baby anytime soon. I won't be able to work. And they said, that's okay. We want you to start working here before you have the baby, so that way you have your 90 days, whatever. And I'm like, this is great. I love this place. Like, I loved working here, and I was just volunteering, helping Miss Claire do pap smears in women's health. And then I started officially working in May, right, full on in the middle of the pandemic. And it was chaotic, it was so different. But I like working here because they I support their mission in helping people without a cost, just wanting to help people. And it's not about money, it's not about profit, it's not about anything else, it's not business. It's really, truly because they care and they really, really live up to their name, Agape.
Hi, my name is Rebecca. I'm one of the nurse practitioners here at Agape. I was first introduced to the clinic as a student at Baylor in their graduate nursing program. And after graduation, I started to teach there, and I actually brought students here for their clinicals, and that opened the door for me to get a job here. And one of the things that attracted me to Agape is their focus on working with providing medical care, health care, and now dental care to patients who don't have access in other places. And that's been a passion of mine, and actually the thing that led me to become a nurse practitioner. So when I found this clinic, the mission of the clinic just really speaks to my goal and my desire to use my career and profession to help people. One of the unique things about our patients at Agape is the backgrounds they come from. It's very different than the average healthcare office in the Dallas Metroplex. We have patients that have had, we'll say, tumultuous histories. Things that have brought them to the United States aren't always the happiest of moments. Sure, some have immigrated for business or education, things like that, but we see a lot of people who are refugees, asylum seekers, and they're here to receive care because they don't qualify for it in other places. We've had patients who are survivors of torture, of rape. They've ran from dictatorships, from tribal warfare, from drug cartels, and they come here looking for care. And one of the things that we're able to do is provide them with healthy human contact, human touch, relationship, provide for their medical needs in a place where they're going to be respected and given the dignity that they deserve. One of the things that Agape has done to meet the needs of patients right now during the pandemic is we started a temporary food pantry. Probably went on for, 6-8 weeks, something like that, and really just bridged that gap. And that's what Agape does. We have patients that are here for years, decades. We also have patients that are here for months. They lose a job, they need a place to continue with their prescriptions and get their health care for a few months before they get a new job. We have people who are establishing residency and come. So it's an integral part of the community, and when people are invested in that, it makes our community better. The patients that we have here at Agape make our community better, and we value them, and we love them, and we're happy to be here and serve. I'm happy to be here and serve, and I'm grateful for donors that continue to allow us to keep the lights on, the air conditioner going, the heat in the wintertime, and then all the other things that we're able to do with the donations you give. So thank you.
I'm Rankin Hobbs, and this is my wife, Luann, and we've been associated with the Agape Clinic for over 15 years now, and we watched it grow from the basement of Grace United Methodist Church, where they had three exam rooms and a waiting room and a kids' play area, to what it is now, which is a beautiful facility in a standalone place with the addition of the dental clinic. And it's really been fantastic to watch the Agape Clinic grow and flourish over the years that we've been involved.
What I love about Agape is how they just take every dollar that you donate and turn it into millions practically in the care that they are giving people in our community, people who can't afford health care and who do not have health care. There's a lack here in our city of quality, affordable health care, and they fill this need with such excellence and such a care and compassion for our community that I just encourage everybody to get involved with Agape and learn about Agape, but most importantly, know that every dollar that you give to this clinic goes to help so many, and their dollar just stretches far beyond what most organizations that I've been involved with can do. So we love Agape.
We've just really enjoyed watching Agape grow. It's been a place where we've seen God work, and it's been an incredible blessing to be involved with Agape. And we thank everyone that works there and is a provider there, and we would encourage you to donate and get involved.
Hi, my name is Paul Hoffman, and I wanted to talk about what I've seen here during my time as interim executive director. One of the things that really stands out for me is the staff, the family atmosphere, how they treat each other, and particularly how they do whatever is required to help the patients. If it means going the extra mile, if it means doing something that is not necessarily in their job description, nobody hesitates. And they all are so committed to do whatever it takes to make a difference in the lives of these patients. So with regard to the future of Agape, one of the things that we're looking at is how can we extend Agape's mission and vision into the community. We have a location that serves the East Dallas area very well, but we're aware that there are some medically underserved areas that are not being reached. So one of the things that Agape offers is what I call patient-centered comprehensive care. We're trying to deal with the underlying social determinants of health when a patient comes to us. We want to address all of their needs. So we have multiple disciplines involved here. For example, if a patient comes in for dental, we want to go ahead and screen for hypertension, for diabetes, for cholesterol, for BMI, for depression. We want to make sure that if they have underlying chronic diseases, even though they're coming in for dental, that those underlying chronic diseases are going to be addressed by the medical. Or if they have behavioral health issues, that we want those addressed as well. So we want to offer a comprehensive approach that's interprofessional and multidisciplinary, and that's something that's very unique to Agape.
It has been a busy year here at Agape, but as always, God has blessed us in so many ways. And as we look to 2021, we want to share two important pieces of news and two exciting pieces of news with you. First of all, it is now official. Paul Hoffman has been named Executive Director, and we are really proud to have him officially on board. And secondly, if you've had a chance to visit the clinic lately, or if you attend our gala, you will see our new mobile unit in the parking lot. This was a gift to us from a clinic in Oklahoma. We've just completed the necessary mechanical repairs. We're going to have it rewrapped for Agape. And then the next step, we're going to be very excited about using this to further the reach of Agape and to treat more patients and to further our mission. So we do have a lot to be thankful for. And so on behalf of all of our team here at Agape, we want to wish you a very Merry Christmas. Thank you so much again for all you do, and God bless you.